Okay, so I'm going to demonstrate wound care today. I already have my patient dressed here. I do have a 9-year-old running around, just so you guys know, and a puppy dog. So sorry for any interruptions. So first I would walk into the room, I would introduce myself to the patient. I would identify the patient with 2 identifiers, would also ask if they need pain medication or if they have any allergies, provide privacy for the patient. I would gather all my supplies, which are here already. I would also make sure I told the patient about what the procedure is going to be, the rationale for the wound care, answer any questions, verbally consent if I can perform wound care. So I'd raise the bed up to the level of my hips. So I'm going to perform hand hygiene. Okay. My supplies are already prepared here. Go ahead and put on gloves. Okay. So I'm going to go ahead and remove the dressing. I will make sure I put it in towards the wound so it doesn't come apart. Then take it. Some of the dressing may not come out, some of it will. Okay, so I'll throw that away. Pull the rest of it out here. This would be the part where I would look and see if there was any exudate on the gauze at all. I would make sure I document all of that. I would assess the color, the odor, consistency, and the amount of exudate that I see. I would check for eschar. I now am going to measure the wound. So I would take this little lovely guy here, or whatever I have, and measure the wound. So it's about 4 inches, 10 centimeters, 4 inches. Now I measured the width of it as well. 1 inch. And then I would take a Q-tip, which I don't have, so I'm just gonna act like this is my Q-tip, and I will measure the depth of the wound as well. And then about 1.5 inches deep there. So then I would also make sure I put that on somewhere so I know how the dimensions of it all. So then now I will remove my gloves here. I'm gonna keep these because I only have 1 set. Obviously this would be a little bit more sterile and clean. Perform hand hygiene. If I needed to, I would make sure that I put any PPE on, a mask, gown, anything like that. I would now I need to open my sterile stuff, so I will take my little drape here. So I'd open it furthest away from me first, both sides, then the one closest to me. Okay. And then now I need to put on my sterile gloves. Again, opening it away from me, and the sides, and the bottom there. Okay. This is like that. Jackson, I need you to move, Bubba. No, move. In the video that Professor Nordyke sent us to, he told us to put on 1 for now. Well, this would already be here for my sterile field. So this is not sterile, so I can just open this here, pour a little in there, got my gauze stuff, put it in there, make sure it's wet, make sure I have enough water in there. Okay. And now I'll put my other glove on.
Okay. Okay. Okay.
Okay, so now that both mine are sterile here, I can throw that away. Okay. This says I would irrigate the wound, but I don't have any of that stuff here with me. Obviously, I would not be touching these papers, that my hands are sterile. I'd clean the wound, all that stuff, but I'm just gonna go ahead and just pack it.
Ow.
So, I'm gonna open it up the best I can. Hopefully without ripping it. Okay. Then also, now you can either fold it or, man, this thing is just not wanting to come undone. Okay. Wrap it around like so. Then fold it all up. Kind of like an accordion there. You could use your hands or Q-tip, but I don't have a Q-tip here, so then you'd place it in there. Just kind of gently in there. Okay, let me do the other one. And for length purposes, I'm just gonna go ahead and just do it like this. Just fold it up like that, and then you just start from where you left off there and put it in and pack it in there. Okay. Now my wound's all packed there. Okay, so then now I need to apply the dry gauze.
Okay.
Pull it out of there. You'd unfold it, and the crease needs to be up, and the double side needs to be down where the nose drainage is going to be, like towards the end at the bottom of the wound there. So you'll just lay it in there. Do the same with the other piece here. Open it up, kind of look and see where the crease is. Set that down on there. Then you take your ABD gauze here, and the blue line here means it needs to be facing up. So make sure you try not to touch the inside of this part as much as possible. And flip it around and just lay it on there. Okay, so now that it's laid on there, technically this doesn't need to be a sterile part anymore, so I'll take the tape here and measure how much you're going to put on there. Okay. Rip it on off. It's easier if you fold over the side, so it'll be easy to take off later. My gloves, it's not very easy. Start with the middle first. Place it over the side there. Not doing it much. Okay. So then you'll do the bottom second, making sure you cover the complete. Oh, why am I doing that? I would not be doing that. So then you'd fold all the edges there again. Okay. And when you do the bottom part of the wound, the dressing, you want to make sure that it's completely covered down over the dressing there so it doesn't leak out. So you'd make sure it's just completely in there like that. Then you do the top. Then you put the top on, but make sure you don't cover the top of it completely.
Hi.
Okay. Can you get a view of that? So that's how you put on a dressing change. Okay, then you take off your gloves. And throw them away. All this stuff could be thrown away too, so we throw it all away. Perform hand hygiene. You would make sure that the patient isn't in any pain anymore. So reassess their pain level before you leave. Make sure the side rails are up. You'd perform hand hygiene as well again if they need to be put up. Then you would put the bed in the lowest position, make sure it's locked and the call light is within reach. And then obviously before entering or exiting the room, you would also make sure you perform hand hygiene. And then you would do all your documentation, which is all the wound, things that you saw, the exudate, everything like that. See if there's any pain, things like that. So yeah, dress and change.